Hello, my name is Corey Bianco, and I am with the AUA and Urology Care Foundation. November is Bladder Health Month, and each week we are breaking down important bladder topics to make sure you know how to keep your bladder healthy and happy. This week we're focusing on incontinence, overactive bladder, and stress urinary incontinence, and we are so lucky to have Dr. Jason Kim here from Stony Brook University Medical Center here to talk about these issues. Thank you so much for joining us.
Thank you for having me.
So to start out, what exactly is incontinence?
Urinary incontinence is an involuntary loss of urine, and this can be extremely distressing, and it's extremely prevalent in both males and females.
Now, what symptoms, you're saying, what symptoms should people look out for before reaching out to a doctor?
Urinary incontinence, like I said, is involuntary loss of urine. So any bothersome symptoms, there's different types of urinary leakage. And so the two most prevalent types are stress urinary incontinence and urgency incontinence. Stress urinary incontinence would be the involuntary leakage of urine with coughing, laughing, sneezing, exercising, and so forth. Whereas urgency incontinence would be the kind of, I gotta go, I don't have enough time to get there, and I wet myself before I get to the bathroom. And generally, when these start interfering with your activities of daily living or lifestyle or become stressful, I think it's time to see a physician.
Now, is this something that can be cured? What treatment options are available with incontinence?
I'm glad you asked that, because as a incontinence specialist, we find that most patients are not aware of the many treatment options we have. So the first thing is, the most important thing is to be evaluated by a physician who has an expertise in this area, because it's important to determine the types of urinary leakage. And again, I said the most two common types of stress urinary incontinence and urgency incontinence. Typically for stress urinary incontinence, we have some behavioral modifications, pelvic floor physical therapy, and possibly minor procedures such as periurethral bulking or a minor surgery called minor surgery to put a sling in. For urgency incontinence, we have behavioral therapies, which might include caffeine, alcohol reduction, timed avoiding at specific intervals, pelvic floor physical therapy. If these conservative measures don't work, then we might consider medications. We probably have about 7 or 8 different kinds of medications and several classes that could help with urgency incontinence. And if that doesn't work, we have multiple FDA-approved procedures for urgency incontinence, including Botox injections in the bladder, something called percutaneous tibial nerve stimulation, which is almost like acupuncture in the ankle with electrical stimulation. We have sacral neuromodulation, which is a pacemaker of the bladder. And now last year we had implantable tibial nerve implants FDA approved. So there's so much we can do for both these conditions.
Now, is this more prevalent in men or women, or is it about same for both sexes?
It's typically more prevalent in females. I would estimate probably 30 to 40% of women have issues with urinary leakage, and it's all age groups. I see teenagers, I see 100-year-old women, I see everyone in between. Oftentimes it can be related to childbirth. It's not always related to childbirth. It could be related to estrogen status, and there's so many factors that could cause urinary leakage in women. In men, it's not quite as prevalent. However, we do see it quite often. It's usually related to enlarged prostate. However, there are many other conditions that can also cause urinary leakage.
Now, compared to incontinence, what exactly is an overactive bladder?
Overactive bladder is a syndrome where you might have urinary urgency or urinary frequency, and in some cases you might have urgency incontinence. So urgency incontinence is probably just a subset of overactive bladder, but overactive bladder is like, I gotta go right now. I get the feeling I have to go. I have to run to the bathroom, drop everything and run. Or maybe I go quite often. We have some patients that urinate every 20 minutes. And even though they might not leak, the fact that they have to go every 20 minutes could significantly interfere with lifestyle. You go out shopping, you worry about finding bathrooms, you worry about traveling. I have patients who commute or winter in Florida from New York, and they say, I know where every bathroom is on the way, drive down. So just because you don't leak doesn't mean it isn't bothersome.
Now, with overactive bladder, you're having these issues. When does it get bad enough, or when should you really reach out to a doctor?
Overactive bladder, it's not a life-threatening condition. However, once it starts to become bothersome, some people may go to the bathroom every hour, it may not bother them, then it doesn't necessarily need to be worked up. However, if it interferes with your lifestyle, I think I would urge you to go see a physician.
And what kind of treatment options are available for overactive bladder?
Well, overactive bladder, the treatment options are similar to the ones I mentioned for urgency incontinence, including behavioral modification, sometimes physical therapy, medications, and possibly minor procedures such as sacral neuromodulation, percutaneous tibial nerve stimulation, Botox injections in the bladder, or even implantable tibial nerve implants. There's a lot that we can do for overactive bladder.
Now, I know one thing we constantly hear is, bladder issues can be embarrassing. What advice would you give to someone who might be hesitant to talk about these issues with their doctor?
Don't be embarrassed. One of the things that I hear a lot is, oh, why is it happening to me? I feel so odd. Something's wrong with me. Particularly we get some younger women, let's say 25-year-old woman, and they go, what's wrong with me? And I have to tell them that this is exceedingly common. I've seen 4 or 5 patients of your age today for similar conditions. So I think you need to give them a lot of reassurance and tell them that there's nothing wrong and this is very common.
And you've mentioned this a couple times and just want to go over, this is something that is not just for older patients like people might think. Can you kind of explain how it is something that everybody might deal with?
Oh, yes. I mean, I see all age groups. I've seen teenagers with it, so everyone assumes it's just part of getting older, but not necessarily. We see quite a few younger patients with significant symptoms that do need to be treated.
And I'm trying to think, is there anything else you might want to mention that is important for people to take away during these important topics?
Sometimes people go see their primary care physician or maybe even a urologist, and maybe they're started on medications for overactive bladder. And one of the most frustrating things I see is that I'll get patients, and maybe they've been on medications for 20 years. Oftentimes they've been cycled on 5 or 6 different medications and none of them work. And by the time they come to me, they've lost hope. And one of the most satisfying parts of what I do is oftentimes when they come to me, we talk about some of these minor procedures I mentioned. They had no idea any of this was available. So, and even if I see a new patient, I always tell them, look, we might try conservative measures of medications, but it doesn't always work. Do not lose hope. There is so much more we can do.
I love that message. And that's so important to know just because it's your bladder, you want to keep it happy, you want to keep it healthy, and you don't want to have to run to the bathroom all the time. So this was great information. Thank you so much for joining us, and I hope you have a great day.
Sure. Thank you very much.